How does laparoscopy treat pelvic adhesions to improve fertility? Imagine a tiny camera exploring inside your pelvis, helping doctors see what might be blocking your path to pregnancy. That's what laparoscopy does. It's a minimally invasive surgery that allows surgeons to directly view and treat pelvic adhesions, which are bands of scar tissue that can form after surgery, infections, or conditions like endometriosis. These adhesions can stick organs together or pull them out of their normal positions, making it harder for eggs to meet sperm or for an embryo to implant properly. Pelvic adhesions can cause the ovaries, fallopian tubes, or uterus to become less mobile. When these organs are restricted or distorted, it can prevent ovulation, block egg transport, or create an environment not suitable for pregnancy. Studies show that moderate to severe adhesions may be responsible for about 40% of infertility cases. When adhesions limit blood flow or cause organs to stick together, they can also lead to uterine spasms or problems with embryo implantation, increasing the chance of miscarriage. Laparoscopy is the go-to procedure for both diagnosing and treating these issues. The surgeon makes small incisions near the belly button and lower abdomen and inserts a thin tube with a camera called a laparoscope. This camera provides a clear view of the pelvic cavity. Using tiny surgical instruments, the surgeon carefully cuts or removes the adhesions in a process called adhesiolysis. This frees up the organs, restoring their normal movement and function. For women with endometriosis, the surgeon may also remove endometrial implants by excising or destroying them with heat or laser, which can further improve fertility. Compared to traditional open surgery, laparoscopy causes less tissue damage, which means fewer new adhesions form after the procedure. Open surgery often leads to adhesions reforming in over half of the cases, but laparoscopy reduces this risk because it involves smaller cuts and less trauma. The quicker recovery time and lower complication rates make laparoscopy a preferred choice for many women seeking fertility treatment. After the procedure, the chances of pregnancy can improve, especially if adhesions were severe. Removing adhesions can restore normal anatomy, allowing eggs to be released properly and fallopian tubes to pick up eggs and sperm more effectively. For women with endometriosis, removing endometrial tissue and adhesions can reduce inflammation and improve ovarian and tube function. Sometimes, additional measures like barrier films are used during surgery to prevent adhesions from reforming, further supporting fertility. It's important to remember that adhesion reformation can still happen, and success depends on factors like the extent of damage and the surgeon's skill. While laparoscopy can significantly improve fertility chances, some women may also consider assisted reproductive technologies like in vitro fertilization if needed. Always consult with a reproductive specialist to determine the best approach for your individual situation. Remember, each case is unique, and personalized medical advice is essential for achieving the best outcomes.